Hi, I'm Russ Jones, and I'm excited to share with you a study I recently conducted about the role of the media censorship of COVID-19 dissenting perspectives using a mixed methods approach. Purdy states in a study that the act of limiting free expression of ideas and information that some people, individuals, organizations, or government officials find offensive or harmful is known as censorship. Were we censored during the COVID-19 pandemic regarding various scientific perspectives? I'm in Mission Viejo, and behind me is this beautiful community that just 3 years ago were in lockdowns. Some were facing losing their job if they did not get the vaccination. People were looking for truth, searching for fact or fiction. Was the pandemic, the COVID-19, released by China? Was it a random event or was it a natural event? We're still trying to understand the dynamics of what happened 3 years ago that really have changed a lot of the things that we do, the ways we live, our understandings of our mental health industry. And for many, people lost some trust in our medical establishments, lost trust in the government because there was not equal access to information. So this study takes a look at this hypothesis: media censorship of dissenting scientific perspectives regarding SARS-CoV-2 enhanced distrust of government, medical institutions, and mainstream media. And the statement of the problem is this: the censorship industrial complex initiated a constitutional crisis by infringing on the freedom of speech in the name of public health. Do you remember that? It's your civic duty to get the vaccination. Even though we don't exactly know what's in the vaccination, we don't exactly know if the treatments, which weren't really talked about, are going to be helpful if you get COVID. And for the perceived greater good during the COVID-19 and the subsequent pandemic. And this study aims to research the role the government played, the mainstream media played. Did the government coerce the mainstream media to withhold dissenting scientific perspectives? The study also takes a look at the framing theory, which is known to be a part of mainstream news operations. Irving Goffman created this analysis of framing in his book published in 1974 entitled Frame Analysis. So the question I researched is, how did the mainstream media frame COVID-19 and ultimately censor dissenting perspectives? So let's take a look at the design, the quantitative research design. I used SurveyMonkey with a 14-question survey ranging in questions from: did you get flagged for posting perspectives that might go against the official narrative on social media sites like Twitter, Facebook, and whatnot, and what was known as COVID-19 heterodoxy, which is a kind of censorship of dissenting perspectives. And Criswell says that taking the quantitative and the qualitative helps you marry these two processes to gain a greater understanding. So we sought 75 respondents. We actually got 75. On the qualitative, I interviewed 5 people, and it was only 5 due to the time limitations of this project, using semi-structured, open-ended interviews, exploring the participants' thoughts. I talked to 3 doctors and 2 social media users that experienced censorship during the pandemic. These people ranged in age from 25 to 65 years of age, and I talked to them in a blend of phone interviews as well as Zoom. So testing the hypothesis, I used the ANOVA method and p-value methods incorporating a 0.05 significance level. The 14-question survey tested the hypothesis that the government censored mainstream media of various perspectives. And what surfaced out of this is 2 groups were tested. One that trusted Fox News channel and one that did not, a news channel typically known for being more conservative in its perspective. And we included Fox News with CNN, mainstream media, and sites like the Washington Post. The test found that there was no statistical significance. There are people on both sides of this issue, those that did trust and those that did not trust. So using the ANOVA method and the p-value approach, finding that there was no significant statistical significance, it occurred to examine whether this significance differentiated between the respondents. And it was very, very interesting, as there was a number of folks that checked the neutral position. So we had to take that into consideration. So examination of the means revealed that respondents who trusted Fox News agreed with the considered notion that M equals I included a table in my printed documentation. So listen to some of the qualitative interviews and the responses. I did not trust the mainstream media. Most of my information came from my like-minded doctors who were studying the science, but that science was not being shared in the mainstream news. One doctor said I was banned on Twitter because of my dissenting views, but welcomed on Fox News for interviews, which is kind of an odd paradox. I did not expect the level of censorship and propaganda that I received. And yet another doctor said, I study all of my urine samples, and I was starting to see weird signs of metallic substance in people's urine that had been vaccinated, which I'd never seen in all my years, which gives further proof that this information should not be censored. So the conclusion is that there are very strong feelings on both sides of this issue, and that hasn't gone away. And what I would like to leave you with, that as Christians, disasters affect everyone, regardless of color or creed. And nevertheless, from one's perspective, God calls his children to be light in darkness. And Matthew 15:14 states, you are the light of the world, a city on a hill. And I'm on a hill right now, and I can't help but think that we are called to be light in darkness, regardless of your perspective on this issue, and know that God is the ultimate physician and heals us all. Thanks so much for your time.